Hello, everybody, and we welcome you to the Hindu Wellness Series. Today, the topic is something that's really important. The topic for today is self-medication. Why is it a matter for serious dialogue? I'm just going to give you a short introduction before I turn you over to the specialist this evening. There is probably no better time to discuss self-medication than now, a time when an RNA virus seems to be playing dodge with human lives internationally. COVID has brought out several closet traditional and non-conventional remedies, from drinking hot water with a squeeze of lime to a concoction of herbs to a panel of vitamins that will help you prevent the infection. Will it really prevent it? However, in this country, it has been commonplace to rely on traditional wisdom or so-called traditional home remedies handed down generations. While the wisdom of grandmothers can be a solace when tough times are at hand, good intentions do not a good cure make. Increasingly these days, there is the phenomenon of Googling for symptoms and medications. People refill their prescriptions without consulting the doctor, buy drugs over the counter, over or underuse antibiotics, order on the internet protein powders or multivitamin tablets and take them at will. Not all of them are harmless. In some cases, it has caused actual harm, and in others, it has led to long term chronic conditions without any other contributing factors at play. If you have not experienced either long term or short term, then consider yourself plain lucky. But to throw more light, today we have two eminent speakers with years of experience with patients, Dr. Arjun Rajagopal and Dr. Usha Sriram. Our first speaker today will be Dr. Arjun Rajagopal. I'll have a very short sort of introduction just to tell you who he is. Dr. Arjun Rajagopalan graduated as the best outgoing student from Madras Medical College. He did his residency training in general surgery in the US at the Loyola University Medical Center, Chicago, where he was best outgoing senior resident. He obtained a certification from the American Board of Surgery. He is fellow of the Royal College of Surgeons of Canada. Returning to India, he conceived, set up, and helped run the Sundaram Medical Foundation in Chennai since its inception in 1994. He has behind him a lifelong record of thinking, teaching, and talking about evidence-based medical practice, which makes him the perfect speaker for this evening. Over to you, Dr. Arjun.
Thank you very much, Ramya, for that nice introduction. Good evening, ladies and gentlemen. It's a real pleasure and an honor to be here as part of the Hindu Wellness webinar. There is no doubt at all that we are now currently in the middle of a healthcare scenario that was beyond imagination. If whatever we are going through now was kind of made into a video or a movie, most of us would say, well, it's not really going to happen, but it has happened. And the times that we're in now today are extremely, extremely difficult times. Reminds you of the little story about this guy who's got COVID in his early days and goes to the doctor. And the doctor says, examines him, does the tests and all that. And he says, listen, I'm really sorry to tell you, but you have a terrible, terrible disease. And you need to be put into quarantine. You need to be shut up in a room for about 2 weeks or so. And the guy says, okay, but well, how are you going to take care of me? And he says, well, what we're going to do is we're going to put you on a diet of chapatis, dosas, and thin crust pizza. And this guy says, you got to be joking. Well, then the doctor says, no, you're not. That's the only thing that we can slide under the door. The situation, this may be funny, but the situation is really, really serious. It is that serious. We've been shut away and constrained and, kind of separated from all our day-to-day activities in a manner that I don't think any of us could have seen or conceived or even thought of as a possibility. These are very demanding times. And at times like this, it is also quite natural that people when they are either as a part of their ongoing illness or because they have developed something new, it's not unnatural for them to try and do something for themselves. And I think that self-medication in these times is therefore a very, very big problem. Some of the reasons for self-medication is that one, lack of access, and I think that's the biggest thing now. Almost no one wants to go to a hospital, and even the doctors themselves are quite careful about who they can see and how they can see them. So very access is very difficult to a lot of people, particularly in our country. It's an economic issue. The number of people who have been thrown out of work, day-to-day laborers, and I'm sure all of you have been seeing all these absolutely heartrending scenes of poor people left without even their daily food, and they are not going to be able to access them. And then there's always a group of people who resent the patriarchal healthcare system and say, "Who are you to tell me? I can do what I want for myself." Maybe true, but then I think what I always like people to consider when we are talking about this issue of self-medication is that when it comes to a question of, say, making a legal document for yourself, you don't write it out yourself, do you? You go to a lawyer. When it comes to an issue of maybe submitting your annual income tax report, you send it to the auditor. You don't do it yourself. You don't build your house yourself by drawing your own architecture plans. What therefore baffles me is that when it comes to a question of your own health, the thing that is by far and away the most precious thing that you can own, your own body, why are we so quick to just start dropping all these chemicals into us about which we don't have the faintest idea? And it's quite amazing. And I think that when you look at it that way, you really think that you owe it to yourself, primarily by realizing that self-medication is not a simple thing or it's an easy thing to do. The whole question of the human body and its reaction to all these chemicals that we put inside us is a very complex thing. We spend, as part of our medical curriculum, we spend a lot of time, and almost right through our entire practices, we kind of struggle under the fact that things are coming on at us so fast that many of us cannot just keep up with what's coming at us. And we often have to sometimes do a lot of reading and referencing ourselves. It's a very complicated situation. And I don't think that patients can be casual about it. Especially those who are, I will come to this a little later again, those who are already ill and already are under some medications. In unequivocal terms, we have to state that self-medication is not a safe thing to do. Having said that, self-medication cannot be condemned entirely. In many advanced Western societies, they've examined this issue and they have a whole list of what's called over-the-counter medications, kind of prescriptions, drugs and remedies that you can go into and get. And if you have traveled overseas and if you have gone into one of the big pharmacies, you will find that the over-the-counter section is quite large. You can get quite a huge range of remedies and all of that. But again, when you really inspect the situation and examine it closely and scientifically, in my opinion, there are not more than a handful of drugs that you can take utterly safely. First and foremost on the list has to be good old paracetamol, which is sold as Calpol, Crocin, Dolo, what have you. And in fact, in the medical profession, there is the kind of inside joke that this one medicine alone could probably take care of about 3/4 of all general practice complaints. It's exceptional for treating fever, aches, and all that kind of stuff that you get day to day. It's a remarkably safe drug. For all the 40, 50 years of its availability, it is quite safe to take. And it probably would be the medicine that you should reach out to when you're having a fever or some kind of what we call flu symptoms. The other agent that goes along with it, but with a little bit of a reservation, is ibuprofen. Ibuprofen, again, has been around for almost half a century. There have always been reservations about this class of drugs, what are called the non-steroidal anti-inflammatory drugs, and there are dozens and dozens of them. But ibuprofen, by and large, continues to probably be the safest, the cheapest, and the most easily available of what we call anti-inflammatories. When there is a inflammatory component to what you're doing, typically things like arthritis, knee pain, and that kind of stuff, Ibuprofen is a good remedy, and a small word of caution on it, but still by and large it's a fairly safe drug to take. The other third group of drugs that you could use, but again with a little bit of reserve, is some antihistaminics. Allergies are quite common in day-to-day clinical practice, and antihistaminics are available today. The older generation of antihistaminics used to have the problem that they would sedate you, they would put you to sleep, so that when you have somebody on it, you had to warn them you can't drive a car, you can't operate machinery, you can't do complicated things. The newer generation of antihistaminics are all quite safe in that regard. Yeah, most of them are non-sedating. And with some reservations, those are also drugs that you could possibly take. Besides that, it's simple things like antiseptics for your cuts and bruises. And the last one that I should probably mention is antacids, drugs like Gelusil and all that kind of stuff that you can take when you're having little stomach upset, reflux, heartburn, and those kind of acid-related symptoms. Again, this list is not exhaustive. There are a few more that you can. And in fact, as I said, if you go to an OTC counter in the West, you'll find hundreds, but most of them are sort of just permutations, combinations, a lot of herbal remedies, vitamins, that kind of stuff. But having said all of this, I think I must also state a very, very important word of caution here. And that is, if your symptoms or complaints do not completely disappear within 48 hours, don't persist with it. There's something else going on. None of these OTC remedies should really be pushed beyond 2 days. And if your symptoms continue, I think it really is important that you should go and see a doctor and get a consultation about this whole situation. Now, on the subject of self-medication, I think there's also another very important issue that is peculiar to our country and to a lot of developing countries, and that is the practice of pharmacies dispensing medicines without a prescription or a doctor's recommendation. I have done it many times where, without telling me, guy won't know who I am. When I'm standing in a pharmacy trying to pick up something, I always watch. And even within the 5 to 10 minutes of my transaction, you will find at least a couple of people coming in and saying, "Sir, talavaligide, sir, vaitavaligide, sir, diarrhea, bedi," that kind of stuff. And the pharmacist will quickly dole out a few medicines. He'll give them an anti-inflammatory, he'll give them most often he'll give them an antibiotic, and all that kind of stuff. This is strictly speaking illegal. The law prohibits it in India. Pharmacists cannot dispense without a prescription. The law is very, very clear on it, but like many things in our country, it's there in the letter of the law, but it's very hard to enforce. Now, this kind of practice, you can turn around and say it is cheaper and easier than going to a doctor. And that indeed is the reason why people do this, because, especially the less fortunate people in society, for them, that additional 30, 40, 50 rupees for seeing a doctor is an expense. Is a considerable expense that cannot be just shrugged. And so I don't know, I'm kind of a little, don't know how to take a stand on this. You can take some absolute moralistic stand and say, nope, it's not legal. But this happens. This happens considerably. And this also is a very important element of self-medication in India. The problem with self-medication is that patients generally won't tell you they're self-medicating. If the things don't go well and they come and see you for a problem, they will almost always omit the fact that they've been popping something on the side. Either from, most often it's not intentional, it just hasn't reached the point where they feel it is important enough to tell the doctor that. And this can complicate issues. You'll be trying to find out what's wrong with them, and you'll find out they're popping something else on the side because it was at home. And this something else could be something very dangerous, something that they really don't need. So for that reason, again, self-medication is a huge issue. Specifically, and I think I have to make this point again clear about self-medication, it's the habit of popping antibiotics like it's like gulab jamun or something like that, Almost everybody gets a sore throat, gets a little ticklish sensation in the back of their mouth, and they have some antibiotic lying and they pop it. This is the single worst thing you can do for not just yourself, but for society, for your children, and for your grandchildren. Because of this very poorly thought out habit of stopping antibiotics, we are now in the middle of a situation as grim as COVID-19 in the sense that we have infections for which there is no treatment. And we're seeing infections which earlier on used to be seen only in very sick, hospitalized patients. We're now seeing young, healthy people from the community walking in with those kind of infections and needing all kinds of advanced level antibiotics. Uh, Most of the things for which you think you need these viral antibiotics are viral infections. They're caused by viruses. Viruses don't respond to antibiotics. If they did, COVID-19 would be an element of history. And this habit also is extremely dangerous, and that is self-medicating with antibiotics. You have to really worry about that. Lastly, before I wind down and hand over to Dr. Usha, one other practice, we're talking about self-medication. It's also equally important to look at the other side, that is stopping medicines or changing your doses. Once again, we are now in a situation where access to a doctor is not easy. It's absolutely not easy. So a lot of times, out of concern, you may either stop taking a medicine or you may change the dose. This is as dangerous as self-medication. A lot of these medicines, especially as Usha will point out to you when we go down, when we hear her, a lot of these medicines are not things that you can just stop taking at any time. So unmedicating or stopping medicines is also equally dangerous, and it's something that you have to consider. We began by saying that we're living in very, very difficult times. At no point in time have we had to carry on our daily lives under these kind of constraints. Social distancing, people who are, sick, not being, or who are at high risk, not being allowed out of the house, no social contact. All that we are doing now, it is so alien to the way we think and behave as human beings that we are forced into this kind of a situation. And therefore, I think it also is very, very behooves the medical profession that we undertake this sense of responsibility and that we use all methods of telecommunication that are now available to encourage our patients to talk to us. There is WhatsApp, which, is almost anybody and everybody knows how to use. There's email, there are these video chats, there are all kinds of technologies, and most responsible doctors are very open and responsive to it. Lastly, I would also like you to keep in mind that the healthcare profession and healthcare professionals today are exposing themselves on your behalf to a risk that is probably equivalent, if not more than what we have attributed so far to the defense forces. We always were grateful to them for placing their lives on the line in defense of the country. This is happening on a much, much, much larger scale. Healthcare professionals are every day under the risk of dying. So many people whom I know, close to me, whom I have known, have either been very sick or even died. And I think that this is a two-way partnership. I think patients need to realize that doctors are also like them human beings under enormous stress. At the same time, we as doctors also will try, or at least will definitely do our best to realize that we are working under extremely difficult situations. With that, I would now hand over to Dr. Usha, who will speak to you on more specific elements of what we're talking about. Thank you.
Thank you, Dr. Arjun. That was really sobering. Just a short introduction to Dr. Usha. Dr. Usha is a graduate of Madras Medical College again, and she is a diplomate of the American Board of Internal Medicine, the American Board of Endocrinology, Diabetes and Metabolism. She's also the founder of DIWAS, DIWAS, an NGO for the health of girls and women. She currently heads the Department of Diabetes, Endocrinology and Women's Health, Voluntary Health Services in Tharamani, Chennai. She is the president of the Indian Society of Bone and Mineral Research. Her special interests are women's health, women in non-communicable diseases, gestational diabetes, teaching ethical practice of medicine. Dr. Usha, over to you.
Thank you, Ramya. It's always a tough act to follow Dr. Arjun, but I'll try. So the first thing is, there's so many reasons why people want to self-medicate. Dr. Arjun gave a big list of, be it the ease of getting it or the cost or the logistics, or maybe they just have some experience with it. There's also a couple of other things, which is One is someone else is recommending it to them in their family. And it could be a family member, it could be a colleague or a neighbor. And I've had people on even on a flight, offer or ask for medical advice. Like, I'm having something, headache, can you give me something? So this kind of taking medications without a prescription or supervision, I'm just saying that could be potentially very harmful, because even one dose of a medication for someone could cause them a big allergy. So we need to be, vigilant about that. And why do we, whether it's Dr. Arjun or myself or other colleagues, we worry about when people self-medicate? One of the things is, of course, we worry about allergies, and we worry about whether it's going to give them some side effect. But also, many times, it masks or delays the diagnosis. They keep taking something, let's say, for example, for constipation. They just keep taking something for a few weeks or months, and then find out that they actually have some kind of a blockage in their intestine, and they should have gone for a checkup sooner. So one of the downsides of self-medication is actually a delay and a masking of the diagnosis. And then, of course, medications have a way of this habituation, this dependence, there's addiction to many, including some what we think are simple things like cough medication. For example, Benadryl, which is cough syrup, is one of the things which, it has alcohol in it, and it has a tendency for people to keep using it frequently, even to go to sleep. So another way of hitting the bottle, that's what they say when people drink things like Benadryl. And then we really also worry a lot about people storing medications. They get the medications and they keep it at home. And what happens is, um, this is now accessible to children in the house. This is accessible to guests who may be coming to the house. It may be accessible to colleagues and even people who work in the house. So we have a real responsibility about safely putting away medications, and not to have large quantities of them, which then could even occasionally, people can have, overdose and stuff if large doses of medications are kept at home. And expiry dates are important. Every time, medications are bought, I think people should get into the habit of looking at expiry dates, and then also getting rid of old medications. So this is another, people wear it like, a badge of honor. I have a complete pharmacy in my house. I don't think they should have a complete pharmacy in their house. They should not be. That's very important. And I'll just give you a few quick examples, especially, from my field, which is diabetes and endocrinology, and maybe some family members, what has happened. And Ramya started by saying that people are taking this vitamins and supplements and protein supplements and in kashayams and stuff like that. I'll be happy if they took only those things. I'm hearing of people who are taking even chloroquine, self-medicating with chloroquine during these times, thinking that they're not going to get COVID. Taking the medication is going to prevent COVID. That's what I hear they're doing. So let's just quickly talk about vitamins. Vitamins are, again, something that should not be, we shouldn't be popping it like candy, because too much of, let's say, vitamin D, which people take a lot, can cause vitamin D toxicity. I, as a specialist, at least once or twice a month, I see somebody who's vitamin D toxic. Their calcium levels go up a lot, and some of them have even required hospitalization. So everything, only under medical supervision and in moderation. And then there are things like what we call beta carotene, antioxidants. And it's been shown that when you take beta carotene, when smokers take beta carotene, their risk of lung cancer, they have a higher risk of lung cancer, and they can get an aggressive form of prostate cancer. So the best thing for all of these is to take the beta carotene in natural foods and not to pop supplements like people are doing, unless it's been prescribed by their physician to them. So that's very important. And then I want to tell you, this is a very Indian thing of people wanting to get injections for fever. So everybody who works in my house does not come to me for medical advice, because the standard thing is Akka does not give injections. She's no good doctor. She doesn't want to give us injections. What people don't understand is taking injections for fever is like swatting a fly with a big sledgehammer, and you can get an injection abscess, you can get a scar, and worst case scenario, you can get hepatitis or something even worse. So really no one should be taking a shot for a fever, and whether it's a pharmacist who's prescribing it or a doctor who's giving it, or they just go and take it from a nurse in a nearby clinic. So this is also something that should be definitely we should talk to people, talk them out of it. Then comes a few medicines which Dr. Arjun had mentioned about taking antacids for acidity. If only they took on things like gelusil. People are now going straight to the big guns, which is pantoprazole and esomeprazole and things like that. And what we are learning about these medicines is they're not benign. They're great for lowering acid, but they've been associated with gastric cancer. They've been associated with acute kidney injury. They're associated with increased risk of fractures. So we do not want people to be popping these things. And this is one of the most frequently abused, commonly abused medicine right now in our country. Because what's also happening is if anybody takes even something as simple as Calpol or acetaminophen or paracetamol, they think that they should pre-treat themselves with a proton pump inhibitor, one of these medicines, to decrease acidity. So this is all stuff they hear from others, and they self-medicate themselves a lot. So something that I would worry a lot about. So I already mentioned constipation. So again, a common problem. If you treat yourself at home with some home remedy once or twice, it's okay. But if you keep taking, laxatives, there's actually a condition where people can get habituated to laxatives and get into a big problem, or it could be masking a serious health condition that they are having. Then comes some other medicines. For example, people are having some dizziness. I know a distant relative of mine who took his mother's medications for vertigo for several months, and then found to have a tumor in the brain, true story, tumor in the brain that was causing the vertigo. The moral of all these stories really is that when we have a symptom, it's really important to get it checked out. 9 out of 10 times or 9.5 out of 10 times, it's nothing, and it'll go away. It'll be self-limiting. But not to take medications for something like this. Maybe a headache, you want to take a paracetamol. Even there, you shouldn't take aspirin, because my story, if I have asthma and I have hyperactive airway disease, if I took an aspirin, I could die. I'm that sensitive to aspirin. So people should not be taking, even those kind of medicines, which is why when this lady asked me for a pain medicine on a flight, and I was hesitant even to give her, something like Tylenol. I said, I have Tylenol, but I want to be very sure you're okay to take it. So one has to be careful. Protein supplements. People think that either weight gaining substances or weight losing substances. Weight gaining substances like protein supplements, again, not completely without problems. There's an organization in the US called, an organization that looks into the authenticity of nutraceuticals and products like this. And what they did was they looked at 130 protein supplements and found 134 toxins. everything from cadmium to arsenic to even BPA, which is found in plastic, and pesticides. So they found a lot of substances in them because what some of these protein supplements are made of. It's not in the protein itself, but other things that go into it and what they're made of. So really, again, if we need protein, it should be food sourced, or unless it's really under supervision and prescribed by your physician. That's very important. Weight loss drugs, one of the biggest multi-gazillion dollar industry, the internet especially, very, very big problem, because many of them contain caffeine. Many of them contain a substance called ephedrine, which is a herbal stuff. Ma huang, which is a herb, but it's ephedrine. So it can actually cause fast heart rate and heart problems. So the reason they make you lose weight is because they rev up the metabolism. And they do that through this caffeine and uppers and herbal supplements like this. So one has to be really, really, really careful. And all these medicines for diabetes and high blood pressure, heart disease, thyroid, cancer, every one of those. And I completely endorse what Dr. Arjun said, that people not only self-medicate, they self-unmedicate. They unmedicate, and in my practice, what they do is they take a lower dose. Indian bodies need a lower dose. Indian this takes a lower dose, or try pani pakaren. This kind of what I call vishaparicha is not allowed. It has to be something prescribed by the doctor, and we want them to ideally follow those things. Before I conclude, I just want to say also that women in India do some strange things, like postponing their menstrual cycle by taking medications. And this is not something that is to be done. Whether it's a festival, today is Adi Pandigay, or some wedding coming up, or I'm going to Tirupati, and they pop all these hormones into their body without realizing that 20 years down the road, what it may do to them. So I don't think anything other than water and food should be put in really without careful consideration, supervision of a doctor, learning to read the label. All this is important. And lastly, I want to say that one more thing that people do is cosmetics. They use all this whitening, lightening stuff and Fair and Lovely and all that. And I'm not here to talk about this. I would like to talk about the social aspect, but I also want to talk about the medical aspect. When we put these sun blockers like this, unless again medically indicated, it completely blocks off the vitamin D. And as is in our country, we are so deficient in vitamin D. And this is one of the big reasons why women, and now men also, because they also have fair and handsome, they may end up with the serious vitamin D deficiency. So on that note, I want to stop here and say that there are so many reasons why people do this, thinking this is easier, cheaper, safer. They also think natural or herbal means safer. So far from the truth. So they do this for reasons they think is good for their body, but in reality, actually they may be harming themselves in small ways and big ways. Thank you.
Right. Dr. Usha, thank you very much for that very enlightening speech. So we are waiting for some questions to come in. A few questions have come, but I thought, between the two of you, what is this human behavior to self-medicate? Why do people self-medicate as a norm? Is it psychological? Is it genetic? What is it? I mean, why do so many people self-medicate? Dr. Arjun, perhaps, and then Dr. Usha.
It's a complex issue, and actually, if you look at it, there are people who have looked at the psychology behind why we self-medicate. At one extreme end of the self-medication spectrum is something that we all are a little frightened about, and that is addiction. Addiction essentially is the end stage of repetitive self-medication to the point where you now can't live without it. Okay. Addictive personalities are well described in the sense that you can look at them and you know by the way of their behavior, they're always looking for easy exits. Addictive personalities can be described, but addiction is probably less than 1% of all those people who self-medicate. The large majority of people who self-medicate, again, we said are two important reasons: access to a doctor and economic reasons. Okay, you cannot deny them, they're both there. Other than that, it's usually a feeling that, again, there is a lot of comfort in the fact that modern day medicines are actually quite safe. The way they are tested, the way they are put through toxicity tests, and the way that the whole pharma business is monitored, modern day medicines are quite safe. And if they weren't that safe, people wouldn't take them. For instance, if Usha mentioned these proton pump inhibitors, what you take for acidity suppression, they are extraordinarily powerful drugs. They're scientifically engineered. They really are absolute marvels of drug discovery. But the advantage, or the downside is that they're also very safe. It's extremely unlikely that you'll get into a major problem other than what Usha mentioned when people take it chronically. Okay, there is a downside. So that could be one reason is that most of these drugs are relatively safe. Paracetamol is safe, Ibuprofen is safe. And then at some point in time, we cross the line between what we consider as being safe and we extend that rationale to all drugs. And that's when you get into trouble. Okay, that's when you get into trouble. So it is, human beings in general are risk takers. When given an alternative between a safe but longer path and a quick but risky path, psychologically we will take the risky path. We are risk takers. That's hardwired into our own natures if we are risk takers. And I think that also has a large element to play. Everybody says, I took one tablet, nothing's going to happen to me. By and large, yes, statistically true, but if you happen to be the one person to whom it happens, there's always among us, we have one thing where the patient goes to a doctor and says, if I undergo this surgery, what is the risk of my dying? And the doctor says, oh, don't worry, it's only about 1%. The fellow turns around and says, it may be 1% to you, doctor, but for me, it's 100% when I die. So it's the same way, but you always keep thinking it won't happen to me till it happens to you, and then you worry. But and we answer, short answer to what you asked, well, we do it because I think we're inherently risk takers.
Right. That makes sense,
Usha?
Dr. Usha.
Just really quick, besides all those logistic reasons, no time, quick, easy, low cost, and all that, there's also many people have contempt for the whole healthcare thing. They just don't like that whole, the system of they have to jump through many hoops, and their prior experience may not have been very pleasant. So some of those things, and alternative medicine is there. So there's this conflict constantly. Allopathy will cause kidney damage, will cause this, will cause that. So people are looking for Kabajaram, Kashayam, or something else, some escape.
Right. So our questions have been piling up. So maybe I'll throw a few up here. Dear respected this is Sonali Mukherjee. Respected panelists, I have a query on the context of taking homeopathic medicines. Do they work and are they helpful since they do not have any side effects?
Usha, you want to go first? Or?
I have a really short answer. So
all right.
It works. Again, it's has to be prescribed by a person who knows that's that field. Just like we have experts in allopathy, there are people who have studied that as well. And my answer to all alternative medicine is this: the proof of the pudding is also in seeing the results, and also not having the side effects. So if you can show me that your thyroid level is perfect on Varma therapy, more power to you. But we know that it doesn't work.
I'm going to be a little more forthright than Usha is. In my opinion, homeopathy is water. Essentially what they're giving you is diluted to the Avogadro number, which essentially means it's water. When you look at it hard-headed, and indeed it's not my opinion, there's enough scientific evidence to show that homeopathy really doesn't have anything more than a placebo effect. Okay. Now, placebos, we're beginning to examine the placebo effect as a real effect. The human mind somehow seems to be able to latch on to this. So when a lot of these remedies seem to work, it's largely because of the placebo effect and not so much because of what they are supposed to be constituted of. The placebo effect is real. I don't think modern medicine was dismissing it for a long time, but we have now come to realize that the placebo effect is something that the human mind can trigger. And there are studies which have shown that when patients are given placebos and they are told they are getting a placebo, they still feel better. How about that? So the placebo effect is a powerful effect. A lot of the so-called results of treatment, and especially this is true for simple self-limiting disorders, a lot of the effect is placebo. I'm going to get into trouble for this, but I would like to say that I can't see any science in homeopathy.
Right. Thank you, Dr. Arjun. There seem to be a lot of personal questions, but I'll try to make it as general as possible. There's a question on taking B-Cosules, vitamin C, and Dulcoflex without prescription. Is it all right? There are other questions too on self-medication using multivitamins to boost immunity. How safe is it?
Usha, your call.
I'm not sure that you can really, boost your immunity by doing these things. I think a healthy diet and physical activity, adequate hydration, good sleep, these are the things, and stress lowering, these are the things that actually keep your immunity up. And I just want to give a shout out to my colleague, Dr. Deepak Chopra, who's an endocrinologist, by the way, Harvard endocrinologist. He says our cells have a way of eavesdropping on our thoughts. And he says, if you think happy thoughts and positive thoughts, your immune system, your cells, everything blossom. And if you think negative and hostile thoughts, the immune system wills. I'm just saying that the immune system actually goes up by all of those things. I don't think we need to bottle up something. See, for example, amla. You just eat an amla. You don't need to take, amla as a tablet. So generally, I don't prescribe multivitamins unless somebody is on a restrictive diet, or they have exhibited, or they have malabsorption, or they've exhibited vitamin deficiencies. Arjun?
No, I agree with Usha. I think the average person who's eating a normal, healthy diet and is otherwise normal doesn't need vitamins. There are very few specific situations where the body is not able to make them or absorb them, in which case we add them. But I think by and large, vitamins are not required. Multivitamins are not required.
Thank you. Is easy availability of drugs a reason for self-medication? From Ganapati Krishnan.
Yeah.
I'll say that again, Ramya. I didn't get the question.
Is easy availability of drugs a reason for self-medication?
Yes, I think so. I think that could be because nowhere else in the world, including a lot of developing countries, is it so easy to get medicine. The law is strict. They just won't dispense. I mean, if most of you have gone to Singapore, or you'll know how difficult it is to get a medicine. And the same thing, you go to the UK, other than just few OTC drugs, you can't get anything else. And rightfully, I think a large part of the self-medication problem. And this even goes on to things like advanced generation antibiotics. You can go ask for it over the counter and get a third generation antibiotic. A large part of it is because of easy availability. And until that problem is handled, the problem of self-medication will continue to be quite high. Medicines are too easily available. You can get just about anything you want, anytime you want.
Right. are medicines advised by a qualified pharmacist to a sort of self-medication? You already, I think you spoke about it, but in case you want to hammer out at pharmacists recommending drugs, Dr. Arjun?
They can't. But neither by law nor by training nor anywhere in the world can a pharmacist primarily dispense. The role of a pharmacist is to make sure that what the doctor has given is passed across to the patient, right? That's all he can do. His is one of literally of a quality assurance role, that's all. And if there are certain elements with respect to the prescription that he can, for instance, add in inputs like when should you take them? Should you take them with milk? Can you take them before or after a meal? That kind of doubt they're allowed to, but they cannot legally in any sane society prescribe on their own. It's against the law. The problem is the law is not enforced or enforceable. But it's something that's observed in the breach. But they cannot. Pharmacists cannot primarily prescribe medicine.
And also, Ramya, the person running the pharmacy is most often not a pharmacist.
Yeah.
It's just a person who is running the store, at least in India.
True, very true. There's another question. Should we not take the same medicines which were prescribed earlier for the same symptoms, for instance, loose motion or body pain, if they were to recur?
Good question. Usha, you want to take that?
So, see, we, and thank you, Arjun, for saying those nice things about doctors. I think that was very, very important. So, when a patient comes to see me and they have a symptom, and I make my initial assessment and I give them a medication. What I also want to know is how they have responded and how this problem has evolved. So if the problem continued or recurred, that might give, raise some flags, and I might think something else. So I just think that this is not this is what people actually do. They've taken some medication before and they keep repeating it. And unfortunately, the poor doctor doesn't have the real picture.
No, I think also the other reason is that what you mentioned earlier, that like say somebody was taking this medicine for vertigo, right?
Yeah.
Chances are taking the same thing might have worked, but on the one occasion where it was not due to a simple problem, you run the risk of getting your diagnosis mixed.
Exactly.
What I'm saying is the same symptoms can be due to something else. And this something else could have come new. And that is the real danger. Just assuming that I have the same set of symptoms and therefore have the same disease is not always true. The same set of symptoms can be due to other diseases also. Yeah. The classic example again is acidity and reflux. You keep having it all the time and you keep saying, oh, it's reflux, you take an antacid, till once it happens to be a heart attack and you tend to miss the whole thing. Okay.
Right. I think an answer can't get clearer than that. We have a lot of questions, I think, because of COVID on one Kabasura Kudineer. I'm putting it all together, basically a bunch of questions. Is taking Kabasura Kudineer safe? Does it have any value? There's also a question on taking HCQ. I think the evidence is out there, recommending against HCQ, self-medicating or even in hospitals. So Dr. Arjun and Dr. Usha, Kabasura Kudineer and HCQ perhaps.
So this Kabasura Kudineer is just Kabam Jaram. That's, we have morphed it to Kabaswara. It is Kabam and Jaram. So Kabam Jaram Kudineer is just basically kashayam. It has all sorts of, herbal things in it. So my mom makes a fabulous kashayam. So it's a feel-good kind of thing. So I'm not sure if it is a therapy. I think the idea is for overall for people to get some symptom relief, and then maybe all these herbal things have, the belief is that it's immune boosting and all that. And third thing is it won't hurt. I'm not sure how much it helps, but it may not hurt. This Kudineer. Yeah, Arjun?
No, the problem again here is that when you're dealing with a situation like COVID, when the overall population panic levels are so high, people will believe anything they want to believe, especially when you see like your neighbor died yesterday and, and not just died, nobody was allowed to go to the funeral. The children couldn't see him. We had to be, but that's horrible. We are looking at a scenario that is so frightening that people will believe anything that they want to believe. And that provides room for a lot of bogus therapies, bogus remedies, capitalizing on people's hopes and fears. All that is wrong. It's very wrong, but it's going to require, it's very, very easy for us to say so. But the overall panic level in COVID-19 is so high that a lot of these things are, going to be pushed. And the unfortunate part again is that many of these things are basically innocuous. The reason why homeopathy is safe is because homeopathy gives you water. And water, as we know, is very safe. Maybe not all the time, maybe not in Chennai, but we know it's safe. So when you're dealing with that, those kind of situations where you have a drug or an agent with a relatively low or no downside, you can push them, you can tout them, you can do all kinds of these what are called snake oil remedies. The problem again is, from a scientific standpoint, there is what Bernard Shaw once emphasized as saying lack of proof of lack of validity. It's a very clear logic you have to follow. There is no proof that this thing is not valid, and nobody is going to be able to spend the time or the effort to prove that. So this lack of proof of lack of validity is, we handle it the algebraic way, and we say 2 negatives make a positive. It's not. And I think that's a very dangerous, slippery thinking in our minds, is that many of these untested, unproven remedies are often, because of the fact that they're untested and unproven, the benefit of the doubt is given to them, and the situation overall is one of such great panic that people are willing to believe and buy it. But at the present time, as far as the COVID scenario is concerned, we don't have too many choices. So there's nothing to prevent of any preventive nature. And when you really get sick, there are maybe, 3 drugs that are now approved and available. And we're struggling. We don't know. We don't even know. That's the reason for the panic. Something so prevalent, so common, rising all the time. The panic levels are huge. And I think at this point in time, we have to be a little calm, a little philosophical, so to see. We have gone beyond science right now.
Thank you about that. Dr. Usha, this I think is directly from your speech. There is also the danger of drug anaphylaxis even with proton pump inhibitor, isn't there? I mean, it may be rare, but doesn't it exist? Suresh Sheshadri.
So any medication can have an anaphylactic reaction for that one person. So I'm just saying that even before we share what we think is a simple medication for acidity or for pain or for fever or something, always, first of all, not a good idea to share. Second thing is, just make sure that that person knows what they're taking and there is no history of anything. So, there's lots of anecdotal things. And, like I said, I'm allergic to aspirin, and I was in Madurai giving a talk. I had a headache and I asked for a tablet, and I specifically said it should not contain ibuprofen or aspirin, and they gave me Combiflam. And I came back with a face this big back. So, I'm just saying that one has to be very careful.
Right. There's also a question on what about naturopathy? I think, Dr. Arjun, would you like to?
Same thing again. It is lack of proof of lack of efficacy. It is something that we have no proof of efficacy. And as I said, it's something that's relatively benign. It doesn't really have a downside. They do have a downside in the sense that you can sometimes postpone diagnosis. What could have been treatable might go to this point. But again, I have absolutely no, I wouldn't like to outright say anything about it, but I have, first of all, no experience. And for me personally, I don't think they're effective, other than the placebo effect. I keep bringing this placebo effect again and again because it is a very strong force that our mind seems to have. That is the desire to make ourselves better is able to channel biochemical and hormonal resources to the point of making us well. But we don't know how to do it consistently, scientifically, or repetitively, and that's the problem. Okay, and anecdotes are not data. You know, a series of anecdotes is not data. That's the whole problem.
So also in naturopathy, I see a lot of people going to naturopathy for weight loss. So one of the things that is done is all their present medications are stopped. So that's potentially, you know, very dangerous. And then and many times the you know, all the benefits that they gained in that period of time of all near starvation will all come back with a vengeance in a very short time. And in the meantime, they've stopped medicines, so they've taken actually several steps back. So again, I have my reservations about you know, these therapies.
So I think maybe have half a minute or so, but I think this is a very important question given what we've been speaking about. Is there an alternative testing and validation system for traditional health systems? Ayurveda, Siddha, for instance. And how does one validate these old systems of medicine?
The same way, because the process of validation is independent of the system. The process of validation is only a process of scientific thinking that is applicable to any system. What we call controlled trials, randomized controlled trials, they are not derived from the allopathic system. They are a part of critical thinking. And that same critical thought process can be applied to any system. There are any number of people in alternative health who have submitted their own research to scientific discipline and have been proven to be of value. We're not saying it's not of value. I'm far from decrying it. What I'm saying is let's get proof. Because if you are doing something valuable, then it is society demands that let's get proof. So this validation business is not inherent to allopathy. Validation is a scientific method of thinking. It's a part of the philosophical history of science. And it can be applied to any discipline.
Right, Dr. Usha, I mean,
Yeah, I
all
completely
right.
agree.
Okay. So there is one question that keeps coming up, and I think he's not going to stop until I at least talk about it. So many a times people say that one should not take 2 or 3 pills at once, but keep a time gap of 2 minutes between pills. What is your suggestion over this?
Oh, there's
I don't know. I pop all my pills together for convenience. Usha, any science there?
No, I don't think so, because they're all going to go into the stomach within
Right,
2 minutes
right.
and sit there for a while. So it may just be a thing of you don't want to put too many things in and try to swallow it at the same time and get choked. So that may be the rationale.
Right.
That's probably the real risk. When you're trying to swallow 3 pills together, you could aspirate and choke.
Yes.
Right.
And it's probably safe to take them one after the other. Yeah, that could be a practical reason. I don't think we can,
Right. I think it's nearly time now. It's past 5. So we'll have to wind this down. There are other questions, but perhaps the panelists, I mean, if they would like to, they could answer them directly. I mean, a lot of them are personal advice for patients, etc. But thank you, Dr. Arjun Rajgopalan. Thank you, Dr. Usha Sriram, for a very wonderful evening. And despite the nature of our talk, I think I enjoyed this a lot. I'm sure our listeners, our audience has enjoyed it as much. And I think this is like a starting point for what we do further during this epidemic itself. Thank you very much for being with us, and we loved having you. Thank you, doctors.
Thank you, Ramya.
Thank you, Ramya. And thanks to the Hindu also for giving us this chance to share all the information.
Thank you so much, doctor.
Thank you.
Thank you. Bye.